Hello, hello, hello. Thank you so much for joining for this first episode to kick off Ask Miss Jai Live for season three. Today, we are going to be talking about how we can rebuild or build our organizations to include transgender and non binary people. We know that organizational and cultural change is not quick or easy, but it is necessary. So stick around, and we're going to talk about 5 ways that we can really make impactful, long lasting organizational change and make sure that we're including trans and non-binary people in that. Welcome back to Ask Miss Jai Live. My name is Miss Jai. I use she, her, and he, him pronouns. And I'm so excited to be here for another season to talk to you about all of the ways that we can provide support as healthcare providers or public health organizations to our trans and non-binary community, clients, and patients. So if you are catching this live right now, go ahead and put a hashtag live in the chat. If you're catching it on the replay, go ahead and put a hashtag replay. I can see your comments as they come through. So if you have questions, please don't hesitate to ask. And if you're catching this on the replay, let me know in the comments what is most interesting about this, or what is this having you think about or making you think about in what you could do in your own organizations. Like I said, my name is Miss Jai. I started Ask Miss Jai Live because we saw a need to start talking about how we can support trans and non-binary people in services. We know that oftentimes public health organizations or healthcare providers are the barrier to living healthful lives for trans and non-binary people. And so if we can do something to help shift that and change the culture around how we serve the gender diverse community, then it will help us to be able to access services and address our health needs. So I'm really excited to be back here again. I'm excited to be able to talk to you all for season three and to talk through this very important topic, which is really what I get to in a lot of the crux of my trainings and presentations, which is how do we actually make organizational change? So I'm going to walk us through 5 ways that we can make that organizational change. And I think what's important to really remind ourselves about is that organizational change is not something that can happen overnight. It's not something that happens quick or easily. And oftentimes we might find ourselves in an island as one individual. And so what does it mean for us as one individual or direct service staff or one person in an organization trying to cultivate organizational change? It can be very difficult. And so what we can do instead is we can recognize that as one person, we are unlikely to make organizational change. But as more folks become champions within our organization, as we become decision makers, as we are in positions where we can make decisions and help to navigate and direct programs, we will be able to provide more cultural change, more organizational change within our public health and healthcare organizations. So the first tip that I have for you is to identify and partner with trans and non-binary serving organizations. I think it's a little bit self-explanatory why we would be doing this, but for a lot of us, it's hard for us to see outside of our day-to-day work or what we are doing within the walls of our organization. And so when we are trying to serve trans and non-binary people, we have to go to where trans and non-binary people already are. And oftentimes there are going to be organizations in our communities that are serving trans and non-binary people. They might be community-based organizations, they might be hotlines, they might be organizations that are doing healthcare specific around gender affirming care or hormone replacement therapy. They might be organizations that are doing housing support and work with a lot of trans and non-binary people. So find out which organizations already exist in your local community, whether that be in the same city or the closest neighboring city. Sometimes trans and non-binary people from our communities may travel to other cities in order to get their services because they don't want to be outed or because local services aren't available to them. So also look in the state and the local area outside of just your one city, because you might have services or organizations that serve your area but are located in another city or in a larger city. So identify those organizations and then work to collaborate and partner with those organizations. So how does the public health work or the healthcare work that you're doing tie into what it is that they are doing with their organization. You're serving the same clientele or you're serving the same patients. So how can you support in the local community for their patients or their clients who live closest to you or live within your service area? These are ways that we can start our collaborations. The other part of this too is that for trans and non-binary people, we often talk to one another because we are trying to find organizations, providers who are safe for us to go to. And so by reaching out and collaborating with these trans and non-binary serving organizations, we start to establish ourselves as a safe organization for folks to receive services from as well. So it works in our favor for us to collaborate in these ways because trans and non-binary people will end up finding out that our service that we are willing to invest in their health. We're willing to invest in trans and non-binary people's health. So identifying and partnering can be incredibly powerful and incredibly important. So look for in terms of community-based organizations, are there any trans support groups? Are there any small grassroots organizations that are doing trans and non-binary health work? Are there any organizations, if you're living for me, I grew up along the US-Mexico border in Tucson. And so there are organizations locally that do work around for trans and non-binary people who are undocumented or who are seeking asylum or who are currently in processing or incarcerated in Border Patrol. So partnering with those organizations, if we're serving folks along a border region, can also be helpful. And then also what is available to you nationally. So if you there's the Trans Lifeline. There are organizations that support trans and non-binary people across the United States. And so how can we reach out to and collaborate or partner with those folks? Because if they receive requests for services or support from our local area, we want them to know that we are a resource that's available to those patients and clients to get their health needs met. The second tip is to invest in staff training and development. And what I mean by investing in staff training and development is that we want our staff to know some of the basics, the foundational information around gender diverse communities. So that includes terminology and language. Think of it like a trans 101. So do you know the language? Do you know the terminology? If someone tells you that they're transgender or or identify as a trans woman or non-binary, do you know what that language means? So that you don't have to rely on the patient or client to be your educator in that moment around some of the basics of definitions and language and terminology. But on top of that, it also means training our staff across all levels of the organization. So not just our staff who are case managers or our doctors or physicians or MAs, but also our staff who are working front desks, our staff who are doing registration, phone calls, and intakes, our staff who are our janitorial staff, our security staff, anyone who could potentially interface with our clients or patients needs to receive training on how to best support trans and non-binary people in the environment that you are serving them in. So for example, the reason why we would want to do this, for example, is let's say we have a trans or non-binary client who's coming in for services, and we have security or janitorial staff on site or other staff on site who see them use a restroom and they perceive them to be transgender or they perceive them to be cisgender and that they're using the wrong restroom. And so if we don't have those staff trained to understand what our policies and procedures are, if we don't have those staff trained to understand how we can support trans people in accessing facilities within our organization, then that staff member may try to intercede. They may try to bar access to a restroom. They may try and remove the person from the facility. And so that can all really damage rapport and trust with the community, but it also ultimately harms the individual that we're trying to serve. And so it's important for all staff to understand what it means to serve trans and non-binary people and what the policies and procedures for the organization look like. And then on top of that, recognizing that we can't just train folks once on what transness means and say, okay, we've done it. We've got that all sorted and figured out now, right? Because we know that we have staff turnover. We know that folks are going to shift in their jobs or their positions, and it might be more difficult for them to apply what they've learned to new positions because maybe they got used to talking about gender affirming policies in one setting where they know how to talk about pronouns, they know how to talk about name, and now they're in a new setting and engaging with clients and patients in a new way, and they don't know how to translate that over. So we want to also invest in staff development over time and make sure that we're on a regular basis refreshing their knowledge, but also make sure that we are providing them the opportunity to critically think about how they're serving gender diverse people. And for folks who are watching this, I'm curious, like, what has training looked like for you? So when you started at your current position, what did the training look like for you? Did you learn about trans and non-binary people? Did you learn about policies and procedures and what that looked like? Go ahead and put it in the comments. Let me know if this is something that you've been trained on in your current position, or if it's something that you know that there's training that needs to be done. The third tip is to create programs with your trans and non-binary clients. And again, this can feel a little self-explanatory as to why we would want to do this. But I think oftentimes we get stuck in we recognize that there's a need and we want to create something, and we're really well intentioned around that. We know that trans and non-binary people need services that are tailored for the trans and non-binary community to serve trans and non-binary people, to reduce health disparities. But sometimes we can get ahead of ourselves and just start a program or put rubber to the road very quickly without actually consulting or talking to the trans and non-binary community that we're serving. And so sometimes assumptions eke in because of that, and we make assumptions about what that care should look like, what those priorities look like. For example, if I'm working in a healthcare environment and I'm doing HIV prevention and treatment, then my assumption might be that the ultimate priority for the person that I'm serving, the trans or non-binary person that I'm serving, is that their HIV care is being taken care of, that the cost of it is being covered, that they're able to get their medication, that they are remaining adherent, and either reducing the risk of new acquisition of HIV or reducing the risk of transmitting HIV to a partner. However, what I might find out in having a conversation with the trans and non-binary people that I'm serving is that their priority for their health needs actually has nothing to do with their HIV care or adherence. It could be that their priority is, I don't know where I'm going to sleep tonight. Or it could be that their priority is, I don't know how I'm going to get my gender affirming care covered. I don't know how I'm going to get my hormone replacement therapy covered. I don't know how I'm going to find a job. I don't know how I'm going to be able to pay for food this week, right? So those priorities oftentimes will outweigh that priority that I have come up with, or the assumption that I have come up with in that situation. And so if I create a program and I invest all this time and energy into creating this program, but that program is not meeting the priority needs of the clients or patients that I'm serving, then it's going to be underutilized. However, if I work with trans and non-binary people that I'm serving to develop a program, then I'm more likely to address the priority needs that the patients and clients I'm working with have, and I'm more likely to then further engage them in care and engage them in services in the future for the other pieces that I'm working on, such as HIV prevention or treatment adherence. So working with trans and non-binary clients, getting feedback, and making sure that the programs that we are developing are applicable and are based on the priorities of the people that we are serving. And I would love to hear in the comments as well, if you've worked in an organization where folks have done this with trans and non-binary people, I'd love to hear about that organization. I'd love to hear also about what programs have been developed and kind of like what you learned about developing those programs. So feel free to put those things in the comments as well. And then in terms of getting feedback and information, it kind of moves us into our next tip, which is tip number 4, assess, evaluate, and pivot. I think one of the benefits that we have in the work that we do is one of the strengths that we have in the work that we do is the ability to be flexible. And what I mean by that is we want to make sure that we are regularly collecting feedback from the people that we are serving, that we are evaluating that feedback and how our programs are functioning, and that we are pivoting and shifting gears based off of that feedback in a way that is going to better address the health needs of our communities, specifically for our trans and non-binary clients and patients. So for example, we can receive feedback by having client surveys or patient surveys. We can specifically seek out our trans and non-binary clients or patients and request that they provide us feedback. So not just asking generally all patients or clients, but saying we really want to hear feedback from our trans and non-binary clients. We can put together focus groups that allow us to receive feedback in small group format from several trans and non-binary people at the same time. We can develop a community advisory board for our organization that allows us the opportunity to receive feedback not only from patients or clients who are actively receiving services from us, but also from the community at large, which may hear different feedback around the health needs for the trans and non-binary community. If we have a history or a reputation of not being an affirming provider or not being safe for trans or non-binary people, then we might not have lots of folks already in our services, or they might not be out as trans or non-binary in our services. And so developing a focus, or not a focus group, but developing a community advisory board can help us to get feedback and find out what our community is looking for without having to when it's harder for us to get feedback directly from our patients or clients. And additionally, because I said before, trans people talk, like we really do. We have to get feedback from one another to find out who is safe for us to go to. If someone comes to our organization and has a negative experience, they may not always feel comfortable expressing that they had a negative experience within the organization's walls because of fear of being mistreated in the future, fear of nothing actually happening, fear of getting someone in trouble when that's not what is intended. So we might hear different views of how the community perceives our organization through community members' eyes and through community members' ears and what they've heard about our organization from their trans peers. And then the pivot is the most important thing. So what do we do once we have this feedback? I have seen time and time again when organizations collect feedback from patients or clients, and then that feedback seemingly goes nowhere. So having a negative experience at a clinic and saying, I want to leave feedback, leaving feedback on a form as to like why you're leaving the clinic or why you're canceling your appointment, leaving feedback with the front desk staff, leaving feedback with supervisors, and then nothing really shifting or changing. And as a result, the harm's continuing on, but with other patients and clients in the future. And I've seen that recently, especially when it comes to folks being able to get their medication, folks being able to be treated appropriately, folks being treated with respect, folks being asked about their gender identity, sexual orientation, or their pronouns in these spaces. And then when that feedback is provided, nothing really changing, or the perception of the patient or client is that nothing has really changed. And so we have to pivot our what we do, and we have to do it in such a way that we acknowledge that the feedback has been adapted and has been used within our organization. And so that can look like if we receive feedback that pronouns and name are not being asked by the front desk staff, or if we receive feedback that folks are being misgendered, or folks are only being called by their legal name but not the name that they go by, then active changes on a patient-facing side can look like making sure that we're asking about pronouns and current name versus legal name on our registration forms, that all of our front desk staff are now asking all patients and clients their pronouns, that we have a non-discrimination policy that has been displayed publicly in our clinic or in whatever environment we're in that includes being respected by that includes non-discrimination on the basis of gender identity and gender expression, and includes a statement on the use of pronouns and current name regardless of legal status. So there are ways that we can show the patients and clients that we've actually instituted these changes based off of this feedback. But this is also a way that a community advisory board can be incredibly helpful, because going to a community advisory board and saying, this is the feedback we've received, what are some ways and these are the ways that we want to change, will this actually make a difference, or do we need to develop different ways, shows the community at large that we are willing to shift and change, but also shows the community at large that we are willing to receive feedback on how we're making those changes, so we're sure that we're actually changing in the way that is going to be helpful for our community. I think about a recent example that was shared with me from someone I know who said that they were having trouble getting their medication. They were having trouble getting a hold of their provider. There was all this back and forth, and they went months without getting their medication and ultimately had to discontinue their care because it just was, they were constantly giving feedback that this was problematic, that it was challenging over the course of several months. And ultimately, when they canceled their care with this person or with this organization, they had to say, you know what, at this point, I keep complaining, I keep saying this is something that needs to change. It's not changing. And so now I'm leaving, but I'm also going to tell everyone that I know to no longer get services from you. Or if someone is looking for services, I won't refer them. So it harms our ability to do services well if we are not flexible and able to pivot when we are doing this work. And I would love to hear in the comments below, or in the comments if you're watching this live, what are some ways that your organization currently receives patient or client feedback? Where do you collect that from? And if you're not sure, say, I don't know. I've never thought about where we get that feedback from before, because I think it's important for us to recognize that that might be something we need to investigate to see what that avenue looks like and where that information actually goes. And then the fifth tip that I have for you today is to hire, train, and invest in trans and non-binary staff. So we know in health promotion that, or public health promotion, we know that folks are more likely to access services, especially preventative services, when they are working with folks who reflect the identity that they hold, or some of the identities that they hold. It's one of the reasons why we do community health workers, or we have shifted to a community health worker framework where we're hiring people from the community in order to serve the community. It's one of the reasons why we have in public health several harm reduction organizations and agencies who will hire folks who have experienced substance use challenges, or are actively experiencing substance use challenges, because they are the folks who are in their community every day. And they are the folks who are also going to be able to speak the language and connect with folks at a base level that is non-judgmental. And so we want to we want to hire trans and non-binary people to serve our trans and non-binary clients, but we also want to hire trans and non-binary people to be present at all levels of our organization. So we don't want to say, okay, well, we've hired trans and non-binary people as direct line staff, but we don't have any trans people who are working as supervisors, or we're not investing in our trans and non-binary staff to help them move up the ladder of this public health agency or this healthcare agency. We don't have anyone who's working at a decision-making level who's trans or non-binary. So we really want to avoid those things, and we do that by hiring trans and non-binary people, but also investing in the trans and non-binary people that we hire, so they are getting professional development and are able to take on more responsibilities, but also move up in our organizations. One of the things that we know from social determinants of health disparity research is that trans and non-binary people are less likely than cisgender people to have full-time employment, more likely to be denied a job or be denied a promotion. And so because we know that, it means that when we are hiring trans and non-binary people, we have to be intentional in the ways that we are training and the types of professional development that we are doing. We can't assume that all trans and non-binary people who come into our organizations are going to be on the same level in terms of educational attainment, in terms of having worked in a professional environment, or even know how to navigate some of the unspoken professional rules. Like, how do we send an email that doesn't sound curt or crass? How do we talk to our colleagues? What are some things that would be appropriate to talk to a supervisor about first? What are some things that are inappropriate to talk about in the workplace? These are things that we might need to coach up our staff around, and that investment will pay off because we are making sure that we are bringing trans and non-binary people into our organization, and that we are developing them into professionals in our organization so that they can continue to move up in the organization. The other piece of it too is that when we are training trans and non-binary people, or when we are hiring trans and non-binary people, not training, but hiring. When we're hiring trans and non-binary people, let's look at what our hiring requirements are around educational attainment, right? So if we are requiring a college degree for a position, is that college degree actually necessary to perform in the position? Would applicable lived experience, or would lived experience be applicable for that position instead, or be allowed to offset some of that educational attainment? Similarly, if we require fingerprint clearance in order to work in this position, is that fingerprint clearance actually necessary? Is the position going to be working with folks who are vulnerable, so vulnerable adults or youth? Are they going to be working in a space that actually requires fingerprint clearance or not? Because we also know from social determinants of health and from research about trans and non-binary communities that transness is often criminalized, and the ways that trans people are treated in the criminal justice system means that we are going to be seeing trans people interact with the criminal justice system more frequently just by going about their daily lives because of assumptions of sex work and substance sales, and also the reality of working more in the underground market because of challenges with employment and being able to find full-time employment. So if we know this and we're trying to hire trans and non-binary people, we also have to look at what those policies are around hiring, and are we asking for things that are going to automatically push a large section of the folks we are trying to hire out of eligibility for hiring. So those are the 5 tips that we have for, or that I have for you, for how we can start to rebuild or build our organizations to include transgender and non-binary clients and patients. And so to go over them again, it's identifying and partnering with trans and non-binary serving organizations. It's investing in staff training and development. It's creating programs with your trans and non-binary clients. It's assessing, evaluating, and pivoting our programs. So being flexible with those programs so that we're actually serving the need. And it's hiring, training, and investing in trans and non-binary staff. So if you are doing any of these things, any of those 5 tips right now, I'd love to hear about it in the comments section. Please feel free to include what it is that you are doing, how that is looking, and any lessons that you've learned from going through that process. Have you learned that there are pieces that we just make assumptions about, and when it's actually in motion, it looks different? So share that in the comments below. Again, my name is Miss Jai. I run Ask Miss Jai live every Sunday at 5 p.m. Arizona time. I'm really excited to be here for season 3. Please like and subscribe to the YouTube channel where you'll get constant updates. We have some amazing interviews happening this season, so please follow those. And if you haven't yet, feel free to catch up on the first 2 seasons, which are all available on YouTube right now at Ask Miss Jai. And until then, thank you so much for being here and being present for this conversation. I look forward to us building community together. And as always, thank you for investing in the health and well-being of trans and non-binary people. Until next time, stay safe and healthy.